Hi, I'm Dr. Wadsworth here at Uintah Spinal Health. Another common youth injury that we see is lower back pain. With all these sports injuries and sport activities, we commonly see a lower back pain, and more specifically, extension intolerant lower back pain. So pain when they're bending backwards, increased pain that way. And we have a whole video on lower back pain, how we evaluate the lower back pain and diagnose what's actually going on. But we're going to show you one test that will test a muscle that can cause this lower back pain with extension. It's testing the hip flexor. We're going to test the strength, the length of the hip flexor. If the hip flexor is tight, then that can cause lower back pain to go into extension, which can put pressure on the joints itself. And that might be what is causing the pain. So we're going to test this here. Aaron's going to slide to the table. We're going to slide one leg off and the other leg here. We're going to test the right hip flexor. The hip flexor attaches to the front of the lower back, touches the very front of the spine there, and then comes down and attaches to the top of the femur, or right at the hip. So I'm going to hold here. This is going to lock the top part of the hip flexor down, and then what we're going to do is let this leg relax. And we're testing here to see where the tightness is, if his leg can drop below parallel to the floor, and then how loose this knee is, if it can bend down like so, or if it is pretty tight like this. Here we got a little bit of tightness here, and tiny bit of tightness, not terrible, but just something we can work on, but nothing that's severe for Aaron. But we're going to test this muscle here, the tightness there, and then we'll test the other side. So that's one test of our many tests that we do to help evaluate the lower back pain. One that we will do with someone who has extension pain, or pain when they are extending backwards or bending backwards and there's pain in that lower back. One muscle we'll test to see if it's an issue. If it is, we'll treat it. If not, then there's something else we'll evaluate more. You can see that video attached in the links below. And with that, there's other exercises that we'll add on top of this extension intolerant lower back pain, and we'll share those with you now. Alright, so here's a way to test the ankle dorsiflexion and your mobility to bend your ankle in this direction, and then some exercises how to help with that after we get treatment in, and what you can do at home. So what you're going to do, you get to a wall, or get a brush or a broom, but you can get to a wall and pretend this is a wall. You're going to get your toe, your fist width away from the wall. So go ahead and show me your fist. From there, we're going to place here. So I'm going to pretend this is a wall, or just get a pull. You can raise your arm up. And what you're going to do is you're going to bring your knee to the wall as far as you can, with keeping your heel on the ground. So don't lift your heel up. Go as far as you can this way. So go move forward. So Aaron can get here. His ankle is staying here, so he has good ankle dorsiflexion. The other thing they want to do, a lot of people will come down and they'll get to about here when they start to raise the ankle. And that's where we want to really work on the ankle dorsiflexion and treat that and mobilize the ankle that way. What we want to make sure is, flip around this way, when you bend forwards, you want to make sure that, pretend they're your extension of your femur. You're going to bend forwards and make sure your knee is pointing over your middle toes and back, and not diving forward. So show them diving forwards. We don't want to see this. That's just going around the ankle issue that we have. We want to see how far you can go with your knee pointing forwards or a little bit outside. An exercise to do is going to be this movement, but you can grab an extra weight. A couple of things. You're going to do this same movement, weight on your ankle, and just mobilize, rock back and forth in that proper form. The extra weight can just add weight to the ankle. You can mobilize it that way. You can also get a band. I'm going to grab this band here. Oopsie. Grab an exercise band. You can lock it in down below at a door or a chair to pull your ankle down, and then do the same exercise. Pull down, rock forwards. Or just use your foot, your hand, and just hold here. Just some additional things to help mobilize the ankle itself.